Point is here in that fleshy part of your thumb. So just press gently enough to make an impact, not enough to hurt, and rotate your thumb round 3 or 4 times and then hold. And this can be calming by just pressing and releasing, pressing, and then you roll your thumb forward so the nail is just touching in the centre, the very tip, and you exert a little bit of pressure and hold for 30 seconds. More. You pinch, it doesn't matter which way, up and down the side of the thumb, or just working down fingers and thumbs, pinching as you go. If you're working on someone else, you can press, fingertips touching, arms still straight, slightly weight bearing. And then we can pinch. And Freya can learn to do this herself.
Hand and then proceed on to the left. So with hand reflexology, you're going to cleanse the hands just as you would with the feet. Examination of the hands doesn't give you so much information as the feet, so as much as you can look at the palmar aspect or the dorsal aspect, they don't tell you so much about areas of imbalance or areas of hard, dry skin. So we can basically proceed on to the relaxation techniques. And they're a little bit different than the ones we would use. And we're going to start with, first of all, diaphragm rotation. So holding and supporting the hands as we would with the feet. We're going to work across the diaphragm line a couple of times. And what's nice about the hands is the angle that you're working from, you can actually spread out from the middle outwards along the diaphragm line. And also the angle that I can work the solar plexus is more of a hooking technique in that position. So I'm working from above and coming up and under the diaphragm. Work that for a good 5 to 10 seconds. And release. So then we've got the spine, spinal reflexes, starting from the joint of the thumb, going all the way down the outline of the hand to the centre of the wrist for the base of the coccyx. So the spine is slightly more compact than it is on the feet, so you won't be able to count 33 back and the sides of the thumb. Not forgetting the front of the neck at the front of the thumb on the dorsal aspect. Okay, then we can go to filling in all of the brain and the back of the thumb. Before we find those 3 important glands of the brain, first of all the pituitary, the hypothalamus and the pineal. So you're looking for the centre of the thumb. So you're looking for the centre of the thumb print. So we've got the pituitary gland, I'm holding for 5 to 10 seconds. And then we're going to find the hypothalamus, which is literally a millimetre above. And work that. Again, holding for 5-10 seconds. And then we find the pineal gland towards the index finger on the side of the thumb, again a millimetre distance from the hypothalamus, and work that. And release. Okay, so now we're going to turn the hand over and work all the sinuses. So the sinuses working all of the sides and the back, and I'm also going to work the front of the fingers for the teeth at the same time. So this is actually easier to work on the sinuses on the hands rather than the toes, got a lot more space, the fingers are longer and they're easier to access. So I'm actually working the medial and lateral and dorsal and palmar sides at the same time. Massage and release any tension. Okay, so we're going to Okay, so when we get back to the top, the cervical spine, we're going to work all around the base of the thumb and the sides of the thumb for the reflexes for the neck. And you've got the thyroid gland on the inside of this medial side of the thumb, which is different to the feet. So as we're working over the neck reflexes, we're actually working over the thyroid too, and you would find your two pairs of parathyroid glands on top of the thyroid, just as you would on the feet. Then we can fill in all of the base of the thumb and pineal gland towards the index finger. And then this finger and thumb. And then we'll turn the palm.
Get hold of the wrist, interlace the fingers, and we'll rotate the wrist round and back the other way. Same on the other side, interlacing the fingers, rotate the hand round and back. And we're going to come up each finger, massaging up, and then going just with the range of movement that's available to you. 1, 2, 3, and back 2, 3. So for each thumb and finger, we'll massage up and then rotate. Moving on to the other hand then, same thing again. Use. So for the brain, we're going to massage the pads of the thumbs. Again, you can put quite a bit of pressure on here, massaging the thumbs, and you can do one at a time or both together. We'll then move on and do the same on the tips of each finger. Bony pathway to the heel of the hand. Again, this is somewhere where you can put a fair bit of pressure on, but again, the pressure will depend on the age of the person who's receiving the treatment. So a younger child, you would want to put less pressure on. Keeping in mind with all this stress and anxiety, it's part of your endocrine system. So in the middle of the thumb here, we're going to stroke over and back. Moving on then to the adrenals. And your adrenal gland is going to be situated between the web of the thumb, of the palm of the hand, from the tips of the fingers, out to the sides, down to the heel of the hand. Then turning over, we will start massaging up between the bony areas.
The second intercostal space, and this is where the aortic valve should be, on the right side. Now I'm going to move on to the pulmonic valve, also on the second intercostal space, and this is where S2 sounds are heard the loudest. I'm going to go down to the third intercostal space, where the Erb's point is. And then right below that is the tricuspid valve.
Off, so if you wrap it around the arm this way, it's much easier to wrap rather than going from inside out. So we're just going to wrap it around. We make a little hole, you can just tear it for the thumb. And then it goes right to the end of the fingertips. Sometimes the little finger needs to be covered. And then we just wrap it back around the arm. You can tear off any excess. Okay, so you need to make sure that the fingers aren't too close together. So there needs to be a little bit of room so that they can move their fingers laterally. So we don't want to wrap it too tight around the fingers.
Palpate all the joints, the MCPs, the CMC. This is a very common place where patients report osteoarthritis. I also palpate all the interphalangeal joints, the PIPs and the DIPs. I look at all the joints. I look to see if there's a ganglion cyst, which is commonly located right here on this part of the wrist. Sometimes it could be located in the palmar side of the wrist. I also look at the DIPs to see if there are any mucus cysts, which you can find here sometimes. I look at the palmar fascia to see if there are any signs of a Dupuytren's contracture, where you'll have nodules and you'll have a contracted finger. I look at the elbow to see if there are any signs of olecranon bursitis. I then have the patient passively just put their hand with adduction of the pinky. That also suggests an ulnar neuropathy. After I inspect the hand, I then do sensation. So I use my 2-point discrimination test, which is my paper clip. I'm going to first evaluate the pointer finger. That would suggest a median nerve neuropathy. I have the patient close your eyes. You feel 1 or 2 pokes.
2.
And then the pinky as well.
2.
Excellent, that's sensation. The pinky is ulnar nerve, and the pointer is median nerve. I then check strength. I tell the patient with your thumb, push up against me nice and strong. That's the abductor pollicis brevis, and that would suggest a median nerve neuropathy, also called carpal tunnel. I then use the ferment test, so I tell the patient to make a fist, hold this and keep your thumb nice and flat. This is ulnar nerve. If their thumb is flat, that's normal. If they end up flexing their thumb, that's abnormal. It's a positive test that suggests a weakness of their ulnar nerve. And then I move on to the provocative maneuvers.
If you press over the A1 pulley and ask them to make a fist, you can feel the nodule moving, and you can feel it in normal patients. Probably on yourself it's most obvious on the middle finger, and if you grip fairly tightly, then the tendon does lift up, so it's more palpable. So you do want to compare to the other fingers if they're pain. Just highlight over the thumb, the A1 pulley is around the MCPJ crease here, and therefore your incisions and your pain will all be around this region. From a movement point of view as well,
the TMJ clicking, popping, or crepitus. Continue going down to assess the masseter muscle. The masseter muscle is another masticatory muscle that we can assess through palpation. Asking your patient to clench will help you to localize the superficial masseter muscle. The neck examination follows the sequence. Approach from behind the patient's head and identify the inferior border of the body of the mandible, and place your fingers in the submandibular area. Ask your patient to lower the chin and gently but firmly press the skin of the submandibular region against the mandible, and roll the tissue bilaterally under the inferior border of the body of the mandible.
It's like you're pretty even toned. You have just a few little areas here and there. But I think you wear makeup pretty much every day, so it doesn't look like you have any serious acne or anything. Do you feel like you have any dryness in any particular area? Does it feel like it's rough? Trying to see if you have any redness, splotches. I don't see anything really going on. Everything looks pretty even toned. Behind your neck here. Okay. Make sure hair looks fine. I don't see any hair loss or anything like that. It looks like you have hair. Okay, have you raise it up for me. Okay. Let me take a look at this arm as well.
Take my strips, and what I do to kind of make sure I get all my angles right is I tear my strip off, then I come down here, placing each strip kind of where it goes. That way I can lay my tape flat and I don't have to fight with working a big chunk of tape in between his thumb joint there. Each strip that you lay down, you kind of want to move up the thumb about half of a tape width. So you do 3 of these. And after that, you move back into your 1.5. One more here. And then to close off all those C-strips, you go to start on the back of the hand here. Run your tape up. You can pinch it right here, so it slides in between their thumb joint. Helps not cause any blisters. Come down here, and then wrap up back around the wrist. Hold it down to your athlete. Your thumb's pretty easy to cut circulation off too, so you just give it a squeeze. Make sure you get some good capillary refill.
Now, I'm going to look for any bony abnormalities, any tenderness. I'm going to look at his hair distribution and texture. Make sure all that looks okay. And all that does. Palpate the sinuses. Make sure all that feels okay. Noticing any tenderness or grimacing. Do you feel any pain upon palpation? No. Good deal. All that feels great. Nose. I'm going to start at the pre-auricle, the post-auricle, the submandibular, submental, the clavicular, post-clavicular.
Your patient together and hold for 1 to 2 minutes. Pain, tingling, or numbness in the foot, toes, or ankle is indicative of an interdigital neuroma. If pain along the long axis of the bone or toe being tested, in this case the great toe. Pain at the site of injury is indicative of a fracture. Metatarsal head, the other grasping the second metatarsal head. You'll stabilize one of the metatarsal heads while moving the other in a plantar and dorsal direction. The procedure is repeated by moving the lateral metatarsal head until all 4 intermetatarsal joints have been evaluated. Pain, or increased glide or decreased glide compared with the opposite extremity, is a positive and indicates trauma to the deep transverse metatarsal ligament, interosseous ligament, or both. Close to the joint to be tested. The bone distal to the joint being tested is grasped near the middle of its shaft. For valgus testing, the distal bone is moved laterally, attempting to open up the joint on the medial side. For varus testing, the distal bone is moved medially, attempting to open up the joint on the lateral side. A positive while passively dorsiflexing the foot and toes. This position is held for 5 to 10 seconds. A positive test is pain and or paresthesia radiating into the foot. The implications of this test are posterior tibial nerve
Nothing looks excessively dry or wet. You have any lesions, any fungus between your toes or in your toenails. Fungus can spread, from person to person.
Okay.
Any pain?
No.
Okay, great. And then your capillary refill time, we just want to make sure that it's under 3 seconds. Otherwise, it looks good. This is a painful toe?
Yeah.
All right. We'll skip over that one.
Okay, thank you.
Next, I'm going to check vascular, make sure that everything's going well. So your dorsalis pedis would be right here.
Okay.
I'd say you're a 3 out of 4, which is very good. That's normal.
Okay.
And then posterior tibialis, also a 3 out of 4.
Yes. Yes. Yes.
Good. And next foot.
Yes. 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 Yes.
5.
Okay.
And if it's up or down.
Okay.
Close your eyes.
Okay. The fifth toe up. The third toe down.
Good. This one is called the Babinski. I'm just going to go medial to lateral on the bottom of your foot. It's going to test some of your nerves. So go ahead and close your eyes.
Okay.
Awesome. Next, keep your eyes closed.
Perfect. Take a look.
Back. So that's good. Once it goes beyond 90, we want about 10 degrees of movement.
Okay.
Beyond 90 in your ankle. And then we're going to do that with your knee bent. Good. You can hold. Put it in neutral. And I'm going to bend again. And we still have 10 degrees. Next foot. And try to watch out for your hurt toe.
Yes.